spot. I was really glad we did the introductions because it gives me a sense of who's in the room and how it fits into what our ask is here. And so I'm really here. This is our first opportunity to take something out of our skunk works, which is a company called Teleomed Devices, and really unveil it to the world. This is really our launch presentation. And so I'm very happy to be here, and hopefully we'll be able to get advice from this group. We're not really asking for money at this point. Somewhere down the road, we may seek capital. But this is a perfect place. I noticed walking in here, I saw nothing but Macs. And this is the perfect convergence in this room here of doctors and Macs. Because over the years, anybody of the physicians in the office or people that have had their hands on ultrasound machines have wanted an Apple device. So we've answered this need, and I'll tell you the story of how we got here. So we're Phantom. We are the first from-the-ground built application for the Apple environment for the point-of-care ultrasound. You probably know it's being promoted, ultrasound, as the new stethoscope, and we think it will be. So what's our story? In 2007, a company called Intrason invented the point-of-care USB ultrasound. They won an innovation award from the National Science Foundation, and they have in the world market thousands of devices being used safely and effectively. The landscape is full of point-of-care ultrasound devices. We met Teleomed Labs, our parent company, is where most of us came from, the starters of the Teleomed Devices. We're a software solution company. We've worked mostly with academia doing web design. Wes can tell you more about our work with the American College of, I think the renal, what's the, American College of Nephrology. The John and Mary West Foundation in San Diego is one of our accounts. We're working with a vulnerable population of seniors there and integrating it with an HIE to provide a collaborating platform for vulnerable seniors. We've been selected and have done multiple deals with the Leidos and SAIC, who are major vendors for the military, and have provided applications for health applications for the Marine Corps, and we're currently working on a workbook for the Walter Reed Army Hospital for chronic pain management, I believe. That's what our DNA is, but we've spun off a group called Teleomed Devices from the principals of Teleomed Labs, our founding organization, to develop devices, and this is our first device. We've chosen the ultrasound. And this is who are the team of Teleomed Devices. This is me. I'm a former emergency physician. I do clinical work for the county. I take care of inmates at the local county jail part-time, and the rest of the time helping build this group. This is Eli, the original founder of Teleomed Labs. He's MD, PhD, physician scientist at San Diego. He's one of the co-directors of the human design group there, and the Cal IT2 and the distributed health lab. Rishi Graham is an electrical engineer, computer scientist, PhD, who leads our tech group. Heidi Rataj comes to us from show business. She was a former producer for Stephen Boschko, who you may remember brought us Hill Street Blues. She now is engaged in the conversations around vulnerable senior populations and diabetes and telling the story through documentaries and film. Wes, who we have here, makes our work look pretty. He's our designer and leads our artistic work. So what about ultrasounds? The current ones on the market, for the most part, are big, heavy, clunky, expensive, one-trick ponies that don't emulate your workflow. They are over-engineered. Any of you physicians in the department who've had to work with point-of-care ultrasounds realize the knobology is daunting. There's way more things that you can do with ultrasounds than anybody really needs to do. And we've intended to make this simple, radically simple, if you will. And they're over-engineered for most caregivers. Also, what's interesting, and this has developed over the years, the world of ultrasound is almost entirely Windows-based. And many clinicians, if you follow the threads and the point-of-care ultrasound groups on the internet, have been asking for an Apple-based product. None has arrived. We're going to be the first to introduce a product built from the ground up for Macintosh. We've chosen Macintosh because we think the file management system, the QWERTY keyboard, and the graphics and the environment and the deep penetration of Apple in the medical community is a convergence we think is going to be successful. So this is our solution. We've built an app called Phantom. We've done a joint venture with Interson, the inventor of the point-of-care USB ultrasound. We're going to white label their product, and we've built an app to talk to it. I brought a Phantom and the device and the app with me after the session. If people want to play with it, you can play with it, and I'll show you what it does and how you think it might be useful in your practice. What are the features? The features, it's a 3.5 megahertz multi-application probe. It's a single probe. You don't have an array of probes that you see with most ultrasounds. It accurately captures the abdominal, pelvic, and suprapubic windows, so it has applications both for cardiac, solid organs, pelvic organs, and the urogenital system. And most important to all of us who practice in the field, it's intuitive, easy to use, and it emulates the clinical workflow. And we're dealing with a 510 cleared device, and we're flying under the flag of Interson, so we don't need any software as a device clearance from the FDA. We're good to go. And so we are now getting ready for pre-orders. So we have 2 test cases. Our first test case is in the world of urology. And how do we get this thing to play? So this is a live image. Those of you with medical backgrounds can recognize Morrison's pouch, the renal and interface here with the kidney and liver. The device here is looping. You can stop an image and capture an image here by freezing the image. Capture an image, it stores it to the library, and you can post-process it with a series of calculations that we've built in with peer-reviewed literature. This particular one is set up right now to do a volume calculation of the bladder, but it can similarly do calculations for crown rump length, biparietal head diameters for the fetus, and then prostate measurements. Here's some still images. Whoop. A large prostate in 2 views and a still renal image. This is a JPEG, which is a product of bladder measurement. We're focusing our initial rollout to the geriatric community. This shows a human bladder, the measurements with a volume estimate. You can save this to your file or upload it to your billing module. Our urological test bed says this will pay for itself with ROI in 2 weeks. Our second test bed is in the Marine Mammal Center. There we have been studying elephant seals and sea lions. Get very nice windows, even through the blubber. Here's a long axis cardiac view. I don't know how it will project here in the lights, but you can see, here you can see mitral valve, septum, left ventricle, Same principles apply. You can freeze, store, post-process. Here's some of their images from marine mammals. Here's a solid organ, abdominal organ from a sea lion. So join us. This is our official launch. We plan to sell the product for $39.99. As you know, most point-of-care ultrasounds are in the $40,000 range. And most point-of-care bladder measurement devices, which are one-trick ponies that only do bladder, are in a $15,000, $20,000 range. So we think this is going to be a useful device at the skilled nursing level, at the clinical level, because it's going to be useful in emergency medicine, doing fast exams, or in the clinic doing any of a number of studies. Very nice images of bladder and of kidney and of liver. So we're looking for collaborators, we're looking for sales channels, we're looking for advice. Not money at the time, but I'm ready to take questions.
Is the $4,000 for the software and the probe?
Yes.
And then you plug that into your own computer?
Yes, in your Mac. Here's the device. You can come and play with it. Comes in a carrying case. Question?
I had a question about competitors because I was at a conference recently and the Philips has a handheld ultrasound device.
Correct.
So I just wondered if you compared it to that or like.
Yes, yeah, the Philips has a product called Lumify. It is a handheld device. GE has a product called the V-Scan, also a handheld device. These are wonderful competitors. They have great tools. They don't have the ability to emulate your workflow. They don't have good file management systems. They're double and triple our price. And they are Windows-based. We're looking to focus at this point in time at the Apple environment. But you cannot go wrong with a Lumify if all you want to do is capture an image. Question?
Are you able to integrate with an EMR system?
Yes, actually, our urology test bed has a cloud-based EMR. And as you capture your images and load them to your file, you can upload to the EMR and upload it to your billing module.
And so I know that you use some in the Marine Mammal Center there, but have you considered going into the veterinary space? I mean, I worked in many different places, school and stuff, and you know that at that price point, I think that would be something that the veterinarians would be interested in.
Yeah, the question is, are we interested in going to the veterinary space? Absolutely. And that's why we've gone to a veterinary test bed. Our first rollout, we're going to be at the American Urological Association at their meetings at the Moscone Center, because we are targeting catheter-related urinary tract infections and bladder residual as our first market. We're kind of focusing right there rather than trying to do an ocean boiler rollout. We're focusing on a high-value, high-risk, vulnerable population. But the veterinary population is going to be very, very important in our future. Other question? Yes, ma'am.
Suggestion. Yeah, I don't know if you've the UC Irvine Medical School has a program where they teach the first and second year students ultrasound interpretation.
Yes.
And then they also send them out to various countries.
Yes.
So you aware of that?
Yes.
Yeah, because that'd be a great.
The ultrasound fellowships in emergency medicine. The question is, what about engaging with university level ultrasound training? And actually, we've just been approached by the group residency group at the Arrowhead Regional Medical Center residency program to use them as a test bed to study our solution.
No, I was thinking taking it further, though, the students get together and they take ultrasounds over developing countries. We have some students that took them to Nigeria, and this would be a fabulous thing in the price point, because just trying to get even a second-hand.
If you have channels and connections, I'd love to talk to you about it. We have one-pagers and cards and little boxes if you're interested in learning more about it. Our Teleomed's founder, Elia, is a specialist in world health. He's worked actively with Mozambique in Africa and has set up informatics programs there. And that is one of our eventual targets, is African continent and also the Portuguese-speaking areas in South America, especially with Zika virus. But we are looking at an international, down the road, as part of our 5-year plan, we are looking at an international rollout. Other question?